Feminist therapists are usually the therapy of choice once a woman, particularly the women, go to see a feminist therapist. They don't go back. They understand that. They feel understood. They feel empowered. And we know it works in the issue of violence cases. And with the statistics about the high numbers of women who have experienced physical or sexual abuse in their childhood, in their relationships, intimate relationships, or in their workplace, we know that that's a critical area that feminist therapy has been very supportive of.
In a few minutes, we're going to be watching you do a demonstration of feminist therapy. And what were your goals in this interview with Gina?
Well, this was an initial interview with Gina. I knew almost nothing about her when it started, so my major goal was to learn a little bit about her and about what was important to her. I wanted to know what kind of background she grew up in. Interestingly, although she's an African-American woman, she's a professional woman and grew up in a professional, educated family. And so we have to be very careful about making assumptions just by somebody's racial identification, also looking at class, at history, at educational levels, and social political kinds of contexts, and where those values that she would have might clash with society's expectations for her. So I was very sensitive both for gender and for race and culture in this particular case, just knowing that little bit of information. I also knew she was getting divorced, but I didn't know much more about it. And I knew she had at least one son. So I knew she was parenting, who she had just come from watching his first basketball game. So I knew that she was parenting an almost adolescent child. And so that's where I started with, okay, what does, what she comes to in therapy, what are her styles of dealing with these kinds of issues based on what I know about human behavior and what she presents. And we went from there.
Is there anything that we should be watching for? Anything particular from that session that the audience should be looking for as they watch this?
Well, I think the issue of abuse does come up, and her disclosure of the abuse. And I would suggest watching the directness of my questions and my response to her presenting the abuse issues, my allowing her to present it, my naming it, my validating her story so that she can continue talking about it. I use a technique that I have developed that comes from a combination of feminist therapy and trauma therapy, where I actually I ask her to tell me about 4 specific incidents of abuse so that I can get a sense of what this is about for her and what kind of violence it is. And she begins to open up and talk much more. And my concern for her safety, which she was very, she felt that was a real connection between us. And so I would pay some attention to that.
Would those be the unique features, though, of the feminist approach that we might not see in one of these more male-oriented approaches?
Well, it certainly is one of them. You know, also the intensity of the relationship between the two of us, I think is very important to watch. And my kind of activity and stepping back. My ability to be active and ask very specific, direct questions, but also my ability to step back and give her the space to talk about them without providing a solution right away.
So you really listened and were empathic?
Yes, although that's not particularly feminist. I think that's good therapy. But it's that I also want you to look at the ability to bring out her strengths. I think that's specifically feminist. We're not just empathic with pain, we're empathic with the strengths. And we really want to move to an educational, non-pathology approach, a less authoritarian, but not give up our power as a therapist. Somebody comes to us because we have special knowledge, and we want to not deny that, but we don't want to abuse it.
Well, let's not wait anymore. Let's get on and watch the interview with Gina.